This particular subject is of supreme importance, and the subject is HIV/AIDS epidemic, obviously, and it's taking place in the entire country. Please don't be fooled. This has been going on for 10 to 20 years. Not 10 to 20 days, 10 to 20 hours, 10 to 20 months. No, 10 to 20 years. Now, there's a reason for this, and honestly, it's more stupidity and lack of self-control than anything else. HIV/AIDS is no joke, and anybody who has half a brain knows it's no joke. But yet and still, people do not have the wherewithal to practice safe sex. Now, you're going to get a lot of statistics in this particular video about the number of African Americans affected versus Hispanics affected versus white people affected. Now, if they really wanted to do something about this, they could, because they have reduced the amount of teen pregnancies, etc. Obviously, you know how a teen gets pregnant. Well, HIV/AIDS is contracted pretty much the same way. What they need to do is, number one, to get into these schools and do a heavy duty program informing all of these kids, young adults, about the danger, obviously, of AIDS, HIV, and the need for safe sex. If you can throw a wedge in there, that is going to help to reduce the amount of AIDS pretty much going forward, because obviously the young people are, you know, they're the future, and they're the growing segment of the population. The second place you need to get into is all these black churches. You need to get in there and do a 15-minute dissertation, give them information and literature, you know, where to go, testing, you know, for testing, for, obviously you can go buy condoms in any store. And there are public facilities that provide free condoms, and obviously that would be helpful. The third place you need to go to, and now this is a hard one, is you need to get into these clubs and get with the owners of these clubs, especially in our areas, and just let people know there is a condom dispenser needs to be placed. I said there is one. A condom dispenser needs to be placed in these men's rooms and these ladies' rooms, so that there can be no excuse that if, you know, things are going to get hot and heavy, you know, 50 cents or a buck or whatever, you know, it's going to cost for you to go in there, go get something if you think you're going to have actions, just so that you're prepared. Okay, so now anyway, I'm going to run this particular segment, and it's a rather long segment, but I believe that it's a very informative segment, and we need to get this information out there. We need to pay attention to it. We need to provide the adequate resources in order to combat this problem. All right, and again, Atlanta is not the only place that this is going down. There's a city in the Midwest, I forget the name, that basically has a small population, and the entire population is HIV positive, and these are white people. There are no black people in this town whatsoever. They're all white. They're all HIV infected. So it's not just a black problem, but my focus right now is for my people, and we need to get a handle on this and get this out of here.
While other networks consistently ignore the data when it comes to HIV/AIDS and African Americans, we certainly don't. A new report shows how massive HIV/AIDS is in some neighborhoods in Atlanta. Doctors there are comparing to that of developing African countries. The co-director of Emory University's Center for AIDS Research Center, Dr. Carlos Del Rio, said, quote, downtown Atlanta is as bad as Zimbabwe and other third world countries. A recent study showed that in Atlanta, it is so widespread that doctors and scientists are calling it a massive epidemic. A 2016 prediction from the Centers for Disease Control and Prevention says that 1 in 51 Georgians will contract HIV in their lifetime, making Georgia only second to Louisiana. A 2014 Emory study.
Now, I will tell you, and I'm taking that time so that you can read all of the data because it flashes through really quick. I will tell you that in Louisiana, if you're male or female, you don't want to touch nothing in Louisiana unless they have just come from the doctor, okay, with a certificate in hand that they are clean. Because my experience, and I'm not HIV positive or AIDS, with AIDS or anything else, but I get a lot of information from people all over the country, and I will tell you that it is common knowledge if you are going to get into any kind of a relationship with anybody down in Louisiana, before the word go, before you lay hands on or anything else, you want to see physical evidence that the person that you are going to enter into that relationship with has been tested, because you will see some of the finest women that you could imagine down in Louisiana, and they are red hot. Okay, now as far as Georgia's concerned, again, the word has been out on Georgia for a long time, and that's because Georgia has a reputation for a very high number of African American males being on the down low. So that in itself, is an issue. But separating that, not using adequate protection, obviously helps in the transmission of this infection and disease. So you should have had enough time to read the information that's up on the screen. Let's continue.
Says that Atlanta is the 5th highest rate of new HIV infections in the country. A variety of factors contribute to this, including racial disparities in healthcare, poverty, and the lack of HIV education, and the lack of funding for education and prevention programs. Joining us via FaceTime from Atlanta is primary care physician Dr. David Malbranch, and also via Skype from New York is the executive director of Sister Love, Dazon Dixon Diallo. Also here in the studio is HIV/AIDS prevention advocate Devin Barrington Ward, behavioral health expert, CEO of Black Men's Exchange, Dr. Cleo Monago, president and CEO of the Center for Black Equity, Earl Folks Jr., and also Avis Jones DeWeaver stays with us, as well as Rashad Robinson with colorchange.org. First and foremost, I want to talk about specifically in Atlanta. David, we see these announcements, we see the report, but what has been the reaction from folks there? Are folks marshaling and mobilizing to lay out to confront this epidemic?
I mean, you don't really see a lot of mobilization going on with regards to like communities. You'll see certain churches, certain community-based organizations getting involved in things. But as far as like this global outrage of what's going on in Atlanta, you don't see that as commonly as you would in other cases. And let me just point out that when we look at these statistics, some of these are estimates, and so they're kind of good splash statistics, but these have been going on, particularly with Black, gay, and bisexual men, since 2001. So this is absolutely nothing new, but people are going to act brand new as if this is something that they've never heard about.
So here's what I don't understand. What I don't understand is if someone says this is comparable to Zimbabwe, how in the world leadership in Atlanta is it being mobilized? I don't understand from a political standpoint, from a healthcare standpoint, whether it's churches, whether it's community. That's what I'm not quite understanding. Who should be leading the charge?
Well, I think it has to be a group level. And so there's different levels of people that need to be involved, not only in the community, but then particularly the medical community is one of those things. But when you look at the medical community, it's not going to be representative of the epidemic. So you see, especially when we talk about some of the statistics in Grady Hospital and some of the things in downtown Atlanta, most of the providers and researchers that are doing the work and treating and trying to prevent HIV infection are non-Black personnel. And so there's a disconnect sometimes with cultural competency plus some relationship building as far as looking at someone across the table and saying, this could be my aunt, this could be my uncle, this could be my brother, this could be my father. And so I think there's a general level of apathy. And then I know that Devin and probably some of your other panelists will talk about the policy levels, but in the state of Georgia, it's a very red state. So when you look at these things, you've seen funding being slashed and cut for HIV services. You know that Georgia is one of those states that won't expand Medicaid so that it can participate in the Affordable Care Act, and about 74% of people in Atlanta are going to fall into that kind of coverage gap where they make too much money to get covered by things, but too little to get some of the services that they need. And so when you look at some of these things, it's multi-level, but typically when you talk about the media, it's going to be focused on Black people. It's going to be focused on how we're having sex without condoms more than other groups, which is not true. How we're not mobilizing, how we're not getting tested more than other groups, which is not true. Black people get tested more often than any other racial group in America. The problem is some of these systematic forces from a policy level, from an institutional level, and within the medical community itself are part of the problem.
Well, Devin, this is what I need to understand. Again, if we're talking about what has been described as a massive epidemic, when someone says there's an epidemic, folks respond accordingly to epidemics by marshaling resources, marshaling people. When we had the initial study that came out that talked about 1 in 2 Black, gay, or bisexual men, 1 in 4 Hispanics, 1 in 11 whites, I said on this show, I said, okay, fine, we're going to come back in 30 days so I can get a status report on what the hell is going on.
So there's been work going on in the ground in Atlanta from a policy perspective for quite some time. The problem is that we really need leaders to get skin in the game.
Okay, you say leaders, who?
I would start with Black legislators. So many of the Black legislators in Metro Atlanta, they represent districts that are the hardest hit by the HIV epidemic. And so if that means that we need to work across the aisle until there is a change in party leadership down under the Gold Dome in order to get more funding, to get more resources down there and some of the hot zone areas, and that's what needs to be done.
So here's my question. Who's marching on them? Who's protesting? Who's pushing them? Who's hitting them with emails and tweets? Again, I need to understand, where is the campaign and the mobilization to put pressure to move people to action?
You have organizations like Southerners on New Ground. You have organizations like Black Lives Matter chapter in Atlanta that has put pressure on legislators, on the governor, on even the mayor to have more funding to make sure that this is a top priority. But really, I think this needs to be a voting issue in 2016. We need to encourage the message that voting to end HIV is important.
Cleo?
Well, we're talking about Black men. Sometimes people subconsciously separate same-gender-loving and bisexual Black men from the pool of Black men. But we're talking about Black men. And the reason that I illuminate that is because Black men historically in this country have not been affirmed, been properly attended to regarding health challenges and other challenges, and have pretty much been warehoused and stigmatized. So that tendency in this culture is impacting HIV and AIDS. There is no alarm around this issue. Now they're saying it's like Zimbabwe. Well, 15 years ago they said sub-Saharan Africa. Right. Like David said, this is a retread. It's the same thing. But let's get clear here. We're going into some more decades of paralysis and a backdrop of not really having great care for this particular population. Because, I mean, Devin talked about policy. Look, there's been policy, there's been funding, there's been other ways in which we're supposed to deal with this issue. But the bottom line is that we're dealing with a community that's dealing with internalized oppression, and dealing with second guessing their own worth. I mean, we keep talking about holding people accountable. Well, the community that's at risk, that are part of statistics, are not stepping up and say, wait a minute, how dare you allow me to be neglected? How dare you allow me to get HIV? The community itself is not alarmed. And that has to do with some issues of depression, internalized oppression, and internalizing this society's implication that we're not that valuable.
Earl?
Now, I'm going to disagree with him on a couple of points. Okay, number one, it's not just black men, it's black women, because as far as the number one transmission of AIDS, it's through sexual contact. And, yes, black men do transmit this disease, obviously, but so do black women. And if a black woman, okay, shows the wherewithal, okay, to protect herself, okay, either by demanding condom use or obviously by not submitting to sexual contact unless she's sure about the condition of her partner, that in itself would cut it down. So for him to throw it off on pretty much black men, bisexual, homosexual, etc., heterosexual, no, this is it takes two to tango deal. So I'm not going along with that. And the second point, and most important point that I want to make here is when he said, how dare you allow me to contract AIDS? No, it's not how dare you allow me to contract AIDS. It's, am I a responsible individual and willing to protect myself from contracting AIDS, okay? And nobody's out there making anybody have sex, okay? Unprotected sex, homosexual sex, bisexual sex, heterosexual sex. Nobody's out there forcing anybody to have sex. Now, obviously, everybody wants to have what they want to have. I'm not even going there. But you use your head. Use your head. And I'm talking about the upper head, gentlemen, not the lower head. Okay? You need to be aware, and especially if you would live in Atlanta and you know how hot Atlanta is, and they said, yeah, the hotbeds, and there are, some extreme hotbeds. But it's like I said, it's not just Atlanta. We have towns here in Texas where the doctors, when these young girls and people that are moving into Texas are seeing doctors, the doctors are telling them point blank to be careful because there is a massive uptick in the amount of HIV/AIDS being contracted. And they are telling women and men, use protection, use condoms. Don't just jump into any situation you see with blinders on. So again, I'm disagreeing with him on the responsibility here. Yes, education obviously is important, but we each, as an adult, and again, I'm not talking about kids. I'm talking about adults. We each are responsible for our own actions. So we need to be careful. We need to be careful.
You know what? There's no community will. There's no community will to stop this pandemic. We can stop diseases. We can stop teenage pregnancy. From 1991 to 2013, there was a 61% drop in teenage pregnancies. The fact of the matter is that the government, the community, and those people impacted received the funding and the support to reduce teenage pregnancy. It's the same mode of you get pregnant by having sex, the same way you get HIV. So the fact is, if you have the will to do it, forces, Republicans and Democrats and religious leaders will come up forward and say this has to be done. That has never happened.
So Rashad, I'm sure Rashad and Avis, and then also haven't forgot about you, Days on. What I'm struggling is, okay, where's the campaign? Well, I'm trying to understand. I'm real simple on some stuff, and that is, if I hear one thing, the first thing I say is, okay, where's the response?
Yeah, I mean, I think that there needs to be a response, and I do think that, to the extent that it can be about voting, but if people are not feeling the pressure, Black people vote at high numbers already. Black people voted to put a black person in presidency, and we didn't get all the things. So it simply can't be about voting. I do think it has to be about the translating the presence of these issues into the power that forces people out of office for it. But as a person who is not working, ongoing wake-up call for all of us that in the vast range of issues that we have to be working on, the lives, the health, the future of our community, we have nothing if we don't have the ability to actually live.
All right, Roland kind of short-stopped him on this one because Rashid Robinson, he does a lot of work on a lot of different things, but this really wasn't his focus. It would have been more helpful if he had somebody that was specifically concentrating on this from the color of change that could have addressed this a bit better. So, he kind of blindsided him on this particular question.
People in black history and in world history have HIV. Magic Johnson is living with HIV. The first black anchor person to have a national show, Max Robinson, died of AIDS. We have Arthur Ashe. We have Eazy-E. So we have all of these alarms that's saying, look, you in particular are impacted. But what we have to face is a nation and a community that's internalized being in question about the value of black men.
Yep.
I mean, children are getting HIV. Excuse me, when you talk about, I'm sorry, let me just say this real quick. When you talk about birth control, that's not necessarily a discarded community.
Right.
So people put priority on that community.
Right.
There was an article in the New York Times recently that said black men are being pushed out, black men disappearing. There was no alarm about that. This is a category of black people called black men that are in that group of people that are discarded and not cared about.
Avis, going to go into a break, and Dejan, I'm going to come back to you at the beginning of the break. Avis, what's your comment? Go ahead.
I'll come back at the beginning. It's too much to do really quick.
All right, so let me quickly take a...
All right, so they're going to take a break. I'll bring it back up as soon as they come back in.
Welcome back. We continue our discussion about HIV/AIDS prevention in America, but specifically Black America. I want to go to Avis and then to Dejan to get in on this conversation. Again, I don't like going round and round. I'm about where we start, who's the organizations, who's leading this, who's organizing, who's mobilizing. Avis, your comment.
Yeah, I mean, there are a number of organizations, and I will get to that, but I have to raise the point that this is not just a black male issue. Of all the women who are impacted by HIV, black women make up 2/3 of that number.
Exactly.
And so I think when we erase black women, we do the black community a big disservice when we talk about HIV. This is a space that I worked in tremendously when I was at NCNW. That organization still works on it. There are a number of organizations that still work on it within the black community, but I would say that they have largely been underfunded and neglected by the CDC in terms of the CDC's priorities. Recently, they have been draining money out of black organizations in favor, let me just be very frank here, in favor of organizations that focus on the white male gay community, which is not the primary community, instead of focusing on organizations that focus on black men. So they're taking money out of the black community to focus on this issue within the white community, where it's going down in the white community and it's continuing to be at epic proportions within the black community. I question the priorities of the CDC. They are right in Atlanta. What are they doing in terms of the funding? Whatever they're doing with the funding, they're not doing it in a way that addresses this issue to the degree that it needs to be addressed.
Dejan?
Yeah, I want to absolutely echo Avis and add to that it is about black community. And there are a couple of other issues that I would call on. It is about the CDC, but across the South, including in the state of Georgia, there has never been, I think, I've been doing this work almost 30 years, we have yet to see a dollar go into the state line item budget to go towards HIV prevention or into HIV care other than Medicaid dollars. And of course, without Medicaid expansion, that's leaving out all kinds of single people, including young black men and black women as well. So it's about black men, it's about black women, it's about black children, and even in the state of Georgia, where we should not be having any perinatal transmissions, we have had some, and it's about black babies as well. There are three things that I wanted to say that sort of buoy exactly what's been said before. It is about leadership. It is about, sounding the alarm. And I want to say this. We got to get woke. Black folks need to be woke. It's the stigma goes along with the internalized depression. And where we saw so much activism in the early days of the epidemic, it was mostly gay white men and their allies. I was one of them. That we were able to mobilize and move things out of the anger of the disrespect and the neglect that was being shown toward people with HIV and AIDS. Well, in our community, we live more with the stigma and the shame around HIV and AIDS than we are angry. And I don't know how people mobilize and organize and protest out of shame and out of stigma. I mean, it just doesn't happen that way. We've got to get people angry. We've got to get them angry. And the thing that I wanted to add, though, is that when you sound the alarm, you got to wake up and stay woke. We sounded the alarm a couple of years ago, especially in Fulton County, when we learned that our Black female director of health for the District of Fulton County has somehow managed to oversee neglect and the return of over $9 million in the state in Fulton County of HIV prevention funding. And we had to fight to get just half of that back. And now we're still talking about where the epidemic is worse now than it was even 2 years ago. So there's that. We have a Black male leader of the HIV program at the state health department who, if he doesn't do more, has to go. So there's a lot of stuff where it's about us figuring out how to get angry about this, because when we do get mad, we get moving. And if we're not mad, we stay still. And that's what's been happening in terms of what's going on in Georgia.
All right, so what I want to know, David, Devin, Earl, Rashad, Cleo, Dazon, Avis, all y'all, I want to know, okay, if you look at any particular issue, that there are organizations that are supposed to be leading the effort. Okay, who are they? Where are they? And then what's next?
When it comes to HIV prevention,
Cleo, can I just say that as the director of a local Black HIV/AIDS organization, working in partnership with groups like NASEM, we have Sister Love, we have Anise Inc., we have a number of organizations in Atlanta that, like Ava said, have been drained of a lot of dollars, and we're just trying to put our finger in the dike and deal with people who show up on our doorsteps. It is those organizations that have the capacity to mobilize, the NAACP, the SCLC locally, the faith-based organizations that will mobilize around everything except HIV in our
Here's why I'm asking the question, though. If you say, who's leading the effort in journalism? National Association of Black Journalists. I'm not going to say NAACP. If you're talking about who's doing something when it comes to business, U.S. Black Chambers, Inc. I'm not going to say National Urban League. So what I'm saying is, within the context of Black, gay, same gender loving community, within the context of Black HIV/AIDS, who are the national organizations who should be driving this from a national perspective, and then also aligning and partnering with local people?
When you heard the statistics, Roland, this emergency in terms of 1 in 2 Black men are going to get HIV supposedly, who called you? You are the leader of the Black media press.
Nobody called me.
Nobody called you.
I saw it myself.
Well, I called you, didn't I?
Well, no, that's you. Right. I saw the story, and then when you hit me up, I said absolutely.
So what that shows you, there's no leadership. Because if there was some leadership, that leadership would have saw that article and said, well, hey, Roland, look, this is a Black issue. You represent the Black press. What are we going to do? The bottom line is that there is no Black affirming leadership. The HIV movement was designed by white gays, and then they allowed Black men who like them to take the baton for Black people, and Black people have not had Black people who like Black people in charge of this issue. When white homosexuals that Dazon was working with were trying to save their people, those white men were not in question about the value of white men. They were real clear. We're going to live. We ain't having this. We don't have that kind of advocacy that's being allowed. There's been people like myself who have that perspective in terms of the value of Black people, who've been constantly poo-pooed and called angry and called all these kind of words instead of intelligent human being who has a perspective that can help Black people. There's been a lot of bias.
David, one second. David, go ahead.
Yeah, what I wanted to say was that there are a lot of community-based organizations, and here in Atlanta, there's National AIDS Education Service for Minorities, NAESM. There's a national organization called the Young Black Gay Leadership Initiative, which actually does a lot of work. The Black AIDS Institute, which actually put out a report years ago that talked about if Black America was its own country, it would be eligible for international PEPFAR relief. One of the things that people are missing, and I'm a medical provider, I'm a member of the medical community, what you do need to understand with this is that HIV is not the urgent crisis. People don't see folks dying on respirators in hospitals and sick day in and day out. What we're seeing is a management of it into a chronic disease. And let's be clear, this is not a community-based driven approach anymore. This is a biomedical approach. And when you look at the biomedical approaches, Not only do you have researchers that are predominantly white, you have physicians and physician assistants and nurse practitioners and medical providers who are also that. We are talking about the biomedicalization of HIV, and when you look at that community, it's not going to be representative of the statistics. There are not that many of us who are medical providers, who are researchers, who are doing the work on the ground every day. We need more of us to do this, and we need to stop looking at the CDC as something to save us, and the NIH is a place to save us. The CDC just
Dazon, 1 second. First of all, folks, literally, I have 60 seconds because I have to get to our next topic dealing with black women in fibroids. Final comment, real quick, Earl.
I think until our community.
See, and that's the thing that gets me sometimes about Roland. This is a subject that he should have kept going on because this is going to affect millions of black Americans across the country, if not tens of millions of black people across the country, okay? He could do that, and don't get me wrong, I got nothing against the subject of women with fibroids. I've known a lot of women who have had that problem, and yes, it is a problem. It obviously needs to be addressed, and I may do a segment on it after I finish with this. But this topic, he needed to go on with this one. So anyway, he's going to clean up with one more minute of it, but I just felt like I needed to say that. Sometimes he cuts off subjects that in favor of just continuing with his format, and sometimes he just needs to scrap his format and keep on going with things as important as this particular subject is.
Realizes the value of African black people.
Thank you.
Black people. Until we realize the importance of black males' lives, especially same-gender loving and gay men, we're not going to get any headway in this into defeating this disease.
Devin,
you have to make it a voting issue in 2016. If you're not holding the elected leaders accountable on this issue, if you're not asking directly Hillary Clinton, your gubernatorial candidates, your candidates that are running Donald Trump, whoever is running to lead at whatever capacity, from president all the way down to dog catcher, it has to be a voting issue in 2016.
Rashad.
I think this is once again a question of both leadership and electoral power and building the power of the community.
Avis.
I think really this issue of stigma is a real issue, and that's hampering our ability as a community to face this head on as the epidemic that it is.
Cleo.
I can't say what I want to say, I'll just say this. The black community has issues with gender-loving people. And the ACP and these other organizations, and there's exceptions to all of this, have second-guessed the idea of getting behind saving the lives of homosexual black men. And that cognitive dissonance, if you will, that's going on in our community is getting in the way of us getting out in the streets and demanding that we get to live.
Days on.
And HIV is more than a virus. It is a human rights issue. It is a social justice issue, which is why we need more than HIV/AIDS leaders sounding the alarm. And we are meeting with Secretary Clinton this afternoon, along with other AIDS allies.
Okay.
And we are also calling on Senator Sanders, as well as Donald Trump, to have meetings with the community.
Got it. David, real quick, literally 15 seconds.
We are the answers we are looking for, and I want to call the medical community to the carpet on this. We need to actually go into these medical facilities and demand more from the medical providers that are providing the prevention and treatment services for HIV.
Got it. All right, folks, thank you so very much. We appreciate it. What is going on when it comes to black women and the issue?
All right, so again, he should have gone on longer on that because there was a lot more. Obviously, discussion is needed, but more than discussion, action is needed. Okay, we need to focus on this like a laser because our people are dying from this disease, and it's something that is controllable if you just have the self-control and the wherewithal. And the thought process to do so. And we need to get this out in the open. It needs to be broadcast from sea to shining sea, and we need to take care of it, not just for ourselves, but more so for our children, all right? Because obviously our children want us to be around as they are growing up and become adults themselves.